So I can do even better than describing the 3-year analysis. So we presented our 5-year analysis at EHA this past June, and it's outstanding. What do I mean by that? We're talking about a median survival that hasn't been reached for those patients who achieved complete remission. It's better than we've ever done in ALL. And so when I step back and I think about it, when we started this CAR T-cell process, the expectation for survival was somewhere around 2 to 3%. That's what we started with. We knew from chemotherapy we weren't going to do better than that based on large retrospective series that had been generated, as well as a series from MD Anderson. We weren't going to get better than that. Why? Because we were coming in 3rd, 4th, 5th, 6th, 7th line plus, right? We were really talking about heavily relapsed refractory ALLs that were coming in with blast burdens of 70%, really tough patients. So we went in saying, okay, well, this is where we're at with chemo. With INO and Blena, maybe a little better, 10, 20% long term. Okay, this is what we got to beat. We're 5 years out. And again, if we take the whole cohort, I think it was around 40% survival. If we take those in CR, it was like 50, 60% something long-term survival. Blew me away. How do we make sense of that, right? And this is where I have to speculate. This is where I have to guess. I get excited, you could probably tell. But why would giving a CAR, especially if we still see relapses, because we did, enhance our survival output to that degree? Are we doing more than we think we are by targeting the leukemia? We know that when we look specifically at post-CAR outcomes, they look they're tough. They're tough patients to treat. But I want to try and now create some nuance around that idea. There are those patients who progress quickly, 3, 6 months, probably weren't even responsive to the CAR, right? They had lots of residual leukemia. If we had looked by these more sensitive NGS techniques, we might have seen it. And then there are those who get much longer remissions. Actually, the surprising majority of patients who are now, yes, it came back, but it came back at 9 months, a year and a half. Did we reset the biology somehow? Are we seeing something different that we need to account for that could explain these extended remissions? These weren't easy patients, I can tell you, because I took care of the bulk of them on that trial. These were tough patients, and yet we have this incredible survival output. In terms of digging a little deeper, why did patients progress after CAR T, especially those early progressors? It was clear that they didn't have the same measure of expansion. We could show that we use a digital droplet PCR, but we convert it to a kind of a flow metric to give an idea of how many cells per microliter we need to see. And so we put that in our 3-year manuscript. I think we're developing the 5-year manuscript now to kind of really build on that story and talk a little bit about other sort of factors that might have influenced outcome, hematotox, and a few other features here. But I think the big picture is it worked, and it worked better than I could have ever imagined, and I'm excited to be able to share that again today. I hope the folks who are watching will go back and look at our EHA 5-year data output, because it's really something incredible.